So today we will be performing pin care. And so we have a patient, they have an external fixator device, which is used to keep the fractured bone stabilized and aligned. The pins pass through the skin and sometimes the muscle to connect the external fixator to the bone. There's usually 2 or more pins that are placed on either side of the break of the bone to hold that bone into place. Pin care site is needed to prevent infections, and if someone does get an infection, it could lead to the pin loosening or even needing to be removed. This pin care should be performed at least once, preferably twice a day, and you will need your cleaning solution, you will need gauze, you will need Q-tips, and you will need something to dispose your Q-tips in. You would make sure you told your patient that when showering, they need to make sure that they are using an antibacterial soap and they want to allow the water to run down, no scrubbing, and rinse and make sure you dry. I would notify the provider if I saw any signs of infections while I was cleaning the site, or if my patient had a fever of 101.5 or higher. So today we would come into the patient's room, we would wash our hands, we would introduce ourselves to the patient and ID the patient using 2 identifiers. I would then put my gloves on. We're going to remove their gauze that is on there now. Throw that in the trash. Do the same with this one. So we're going to take our solution. Open that up. We are going to take a clean cotton swab and dipping, and we're going to make sure we use a clean cotton swab on each side. Each of the pins, different cotton swabs. We're going to cleanse in a circular motion, working from closest to the pin and outwards. Going to put that in the receptacle and go to another one for the other one. And you want to do this just to make sure if there was some sort of infection in one of the pins and not the other, you don't want to cross-contaminate these. So now that it is cleaned, we're going to take another cotton swab and we're going to dry it. Do the same with the other. Now we are going to make sure we put their triple antibiotic ointment on and then replace the gauze. I would then ask my patient if they had any questions for me, ask if they are comfortable. I would make sure I put the bed down to a lower height. I would make sure their call light was in reach, and then I would go document.